Arthroscopic osteosynthesis of a femoral head malunion. I have no relevant financial disclosures. This 18-year-old had initial ORIF at an outside hospital for a femoral head fracture sustained from a gunshot wound. He ambulated early with displacement of the fracture and a malunion when he came to us, which was causing lateral impingement against the acetabulum, pain, and a shortened extremity. Note the inferior displacement of the medial fragment and proximal protrusion of the lateral intact femoral head column into the lateral acetabular rim. This is emphasized by the yellow arrow. Previously undescribed, we called this lateral cephalic femoral acetabular impingement. 6 steps involved in treating this malunion included hardware removal, malunion takedown, reduction, bone grafting, fixation of the fracture, and lateral cephaloplasty. We removed the lag screw and could not remove the smaller screws. We used a 1/4-inch angled osteotome to locate the malunion fracture site and took this down using arthroscopic and fluoroscopic guidance. Once we located this malunion site, we then used the osteotome to take this down completely so that we could free up the malunited medial fragment. Once we had performed this sufficiently, then we reduced the fragment in an indirect manner using the previously bent screw to provide reduction of the fragment and distribution of mallet forces over a larger area. Once the fragment was reduced in an acceptable position by arthroscopic and fluoroscopic guidance, we then inserted bone graft putty into the malunion fracture site via an arthroscopic cannula using the stylet to push the putty into the malunion fracture site. We then fixated the fracture similar to percutaneous fixation of femoral neck fractures from outside in with 3 lag screws. We then used a arthroscopic burr to resect a small osteophyte from the intact protruding lateral column, and then checked range of motion to ensure impingement-free motion on arthroscopic and fluoroscopic exams. The patient had radiographic union and clinical improvement with decreased pain, improved impingement-free motion, and high satisfaction.